appreciate if you could hold to it because we're tight on our meeting. Dr. Laurent Marcoux, the President of the CMA.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. My name is Dr. Laurent Marcoux, and I'm pleased to be here in my role as President of the Canadian Medical Association. I'm joined here today by Dr. Jeff Blackmer, Vice President of Medical Professionalism at the CMA. As the national organization representing over 85,000 physicians and physicians in training, the CMA has a mission, that of empowering and caring for patients, with a vision for a vibrant profession and a healthy population. Since 2002, the CMA has taken a public health perspective regarding cannabis in the interest of Canadians' health. We continue as health professionals and physician scientists to urge the government to exercise caution in legalizing cannabis for non-medical purposes in order to protect the health of Canadians. Our position is rooted in 4 key areas. Firstly, we strongly believe that the federal government should adopt a public health approach with regard to the legalization and regulation of cannabis. Such an approach includes 4 main elements: the promotion of health through adequate regulation of marketing and appropriate education, prevention of drug dependence, and access to assessment, counseling, and treatment services, as well, finally, as a harm reduction perspective, all of which should be consistent with the lower risk cannabis use guidelines. We, as a matter of fact, support the steps announced in Budget 2018 for funding for research and education. We know that children and youth are especially at risk of harm given their brain's development, and they are among the highest users of cannabis in Canada. This is why we continue to stress that the age of legalization be 21 years. In addition, the quantities and the potency of cannabis should be more restricted for those under the age of 25. Second, education is required to raise awareness, further awareness, with regard to the health, social, and economic harms of cannabis use. The CMA submits that young people should benefit from public health education. The lifetime risk of dependence to cannabis has been estimated at 9%, but it increases and reaches close to 17% for those who initiate use during adolescence. In 2012, approximately 1% of Canadians aged 15 years and over met the criteria for cannabis abuse or dependence, double the rate for any other drug. The harm reduction strategy should include the development of educational interventions, including training programs, social marketing interventions, and mass media campaigns. Education should focus not only on cannabis's general risks, but also on its special risks for the young and its harmful effects on them. Thirdly, the marketing and advertising of cannabis should be tightly regulated. The experience with tobacco is proof of this. We support strict packaging and labeling of cannabis, and we believe that the same strict approach should apply to health products containing cannabis. Canadians must be protected from any misleading claims with regard to cannabis and be made aware that health products, such as natural health products, non-prescription drugs, or cosmetics containing cannabis are not scrutinized like prescription drugs, despite their being regulated by Health Canada. In some cases, these products, or the companies producing and marketing them, don't even need to provide scientific evidence to support the claims made on the label. Like for tobacco and cigarettes, cannabis packaging and labeling provide an opportunity to raise awareness of the health, social, and economic harms the financial harms as well. This is why we recommend that packaging and labeling be designed by governments and by health professionals, and not by cannabis producers and distributors, nor those with a financial interest or conflict of interest. Finally, we believe that the legalization of cannabis, the need for two systems being reduced. With the legalization, of cannabis, there will be a lesser need for two systems. Once legalized, cannabis will be available for those who will wish to use it, either with or without medical authorization. We therefore recommend only one regime for both medical and non-medical use. Should the government decide to maintain two separate systems, we agree with the amendment made by the House of Commons that the legislation be reviewed within 3 years' time. Criteria for evaluation should include the number of users in the medical system and the number of physicians authorizing medical cannabis use. The CMA welcomes the opportunity to be involved in the determination of such criteria and evaluation processes. In conclusion, the use of cannabis is linked to health risks. Legalizing cannabis won't change the risks. In fact, legalization without strict regulation and public health education may lead to adverse outcomes for youth and adults who underestimate the consequences of cannabis consumption. The government has a responsibility to the public. Its focus should therefore be first and foremost to protect Canadians, especially young people, and to reduce harms to health. Thank you very much, and I would be pleased to answer your questions along with our Vice President, Dr. Blackmer. Thank you very much. Thank you to you.